Good afternoon. I'm Governor John Carney. Thank you for joining us remotely and here in the auditorium to Delaware's response to COVID-19, our biweekly press conference. We're going to go over the situation in our state, some of the difficult challenges that we're facing, and our efforts to address problem areas across Delaware, in particular issues that we're seeing in the lower part of our state. I want to take a minute to thank our tech team. I haven't done that in the many briefings that we've had for getting us online and being at the controls there as we try to get the word out to Delawareans across our state. We appreciate your hard work and cooperation, and everybody else that makes this possible. Today we've got a unique telecommunications thing going on here with Dr. Carol Odom Walker, the Secretary of Health and Social Services, who is zooming in, I guess, to the press conference this afternoon to provide some important information on data that we've been collecting over the last several weeks. Of course, with me also is the Director of the Delaware Emergency Management Agency, AJ Shaw, who's been our point person on this, coordinating the efforts of first responders, community action, public health, working with the hospitals, the healthcare providers, community organizations across our state, and doing a great job, unflappable, each day that we confront this terrible pandemic. I want to make a few opening comments and then go through the deck here. First, we're working kind of on two pathways right now. One is to respond to the COVID-19 pandemic and the virus as it spreads across our state. We'll talk a little bit about that, or a lot about that, with respect to the situation in the lower part of our state. And at the same time, we're starting to think about and stand up an operation that will, when the time is right, reopen sectors of our economy, and trying to do that at the same time. There are a number of factors that we have to have in place in order to reopen. Most importantly, an extensive testing, contact tracing, isolation approach at a level much greater than what we're doing today in terms of testing. And so coming up with that plan, assuring the supplies and resources and the supply chain for it, as well as thinking through how to bring the staff on to do the contact tracing part of it, is a critical component of our ability to move forward after we move through the 28 days of declining cases in our state. And so we do have some time to do that, but obviously the public health team and our other teams in state government with respect to business and labor, working through what those openings might look like, is going to be an important focus over the next 28 days and beyond. And importantly, we do have on the state website a survey to the public to get input on that process, and we would encourage you to engage and to tell us what you think. At the same time, we're going to stand up or work with groups of kind of sector groups focusing on individual sectors in our economy, as we talked about before, and how they can come up safely. But while that's happening, we're going to be really leaning into the challenges that we face, and in particular, addressing hotspots across our state. So let's turn to the data that drives everything that we do. The number of positive cases continues to rise. We're up now over 3,000, almost to 3,500. Very sadly, we've reached the century mark in the total deaths across our state. They still overwhelmingly are in the senior and elderly, frail population. And sadly, and our hearts and prayers go out to their families as well. We've had 703 recoveries, which is important. And again, the number that we look at on a regular basis, and some concern with its increase there, 277 current hospitalizations. One of the things that we're going to see in the county breakdown is about the same number of cases in Newcastle County as there are in Sussex County, and these numbers don't reflect testing that's been done recently there as we attempt to get our arms around the spread of the infection in the poultry worker community in Sussex County. So 1,486 positive cases in Newcastle County, in Kent County 558, and in Sussex County 1394. When you convert those number of cases to a case per 1,000 or per 10,000 measure, that infection rate in Sussex County is almost three times what it is in Newcastle County, and we'll talk a little bit about that. Some of the breakdown there, we also have 4 cases with unknown address, and then some of the other breakdowns that we have in terms of the age range. We're still under, I'm told, we're still under the age 50 in terms of the median age, and that's an important benchmark because the lower that median age, the more likely, or the less likely we have cases in the very vulnerable population, 65 and older. And we've seen that the virus is not nearly as deadly, certainly, and as debilitating in younger adults and children. Next slide that we have is just the series of changes to the state of emergency declaration. We continue to look at that and are looking at some changes today that might apply to the situation that's emerging there and has been for some time in Sussex County. One of the things that is clear to us now as we look at the data, particularly the increased number of cases in Sussex County, if we can go to the next slide, that today we're making it official that the schools will remain closed for students through the end of this school year. We expect that schools and teachers would finish out the last 2 months as they have been with remote learning and get as much instructional time and learning with their students as possible. There's obviously no replacement for in-person instruction in classrooms in terms of the relationships and the services, but obviously doing what we can between now and the end of what would be the school year. We want to get as much benefit for our students as possible, but we've announced today that the schools will remain closed for the end of this school year and encourage our superintendents to start planning for summer learning and instruction, summer food distribution, and preparation for the new school year next year. I know one of the things on their minds is to celebrate seniors as they graduate and to obviously give them some recognition. Won't be a graduation ceremony like we're all used to, and really enjoy and a celebration for families and for those seniors, but some way to recognize their achievement there. So next, we have a series of slides that just show the increase in the number of cases. The hospitalization rate still tends to be lower than our estimated hospitalization rate, which I think in this chart is 15% Correct. Of total cases. Originally, we were using a 20% assumption there, and so that's a very positive thing because it's the hospitalizations and the critical care, the need for critical hospital care is where we worry about people that have COVID-19 dying in the hospital, and so we preserving that capacity in the event that we do get a bigger surge in the days and weeks ahead. We have some slides here that show some of the earlier projections, again, just to kind of demonstrate what we were seeing early on in earlier dates in terms of a steeper increase in the number of cases, a steeper increase in the number of hospitalizations, And so we've consistently been under those projections, and as we've changed the assumptions, the actual graph of our number of cases tends to be closer to the predictions that we've had. So far, and keep our fingers crossed on this, we've continued to be under the projection, both for the number of cases and hospitalizations, and so we hope that that will continue. The next slide, again, is another, this is the actual number of cases versus the projection going forward. In the last couple squares there, tough to see from here, but hopefully where you're viewing from, you can see those that graph sloping upward at the end of the stream there. So next, this is something again that we'll be looking at day by day, and it illustrates pretty well one of the challenges that we have in getting a consistent downward trend of declining cases by day, which, as we have said several times, based on the guidance from the White House Task Force and CDC, you'll be looking for a 14-day decline in those cases. You can see it's kind of uneven. It's up and down the number of new cases per day. It tends to rise on a pretty steady pattern up to where we are today, but on any given day, it could be down a little bit or up a little bit, and that in part is due to the fact that we have irregular testing dates. Most of those tests are being done at hospital locations. We're starting to over-test in so-called hotspots or areas in the state with, a higher infection rate, and we'll talk a little bit about that. Sussex County, some of the minority and vulnerable communities here in Newcastle County. And so we need to correct for that as we look forward, and one of the measures that we're looking at as a trigger is the percentage of total cases that are positive, and so seeing a decline in that measure as a trigger. The next slide should turn it over to Dr. Walker, and why don't I just want to say a word or two before Dr. Walker starts her remarks, and we thank her for coming in remotely. It will be an interesting part, a new part of our press availability here. We've been for several weeks now trying to get data for the testing results that we have by race and ethnicity, because we didn't have a full complement of that data from the beginning from some of the private private testing labs that were doing some of that. We ordered a couple weeks ago that be included, and so we have more data on a contemporaneous basis, so we tried to go backwards and fill in some of those gaps. And we're able to do that to a certain extent, but not completely. And Dr. Walker is going to talk about some of those results and our response to that. So Dr. Walker, thanks for joining us today.
Thank you for allowing me to join the team virtually today. This morning, we launched a page devoted to COVID-19 related data on the Delaware Department of Health and Social Services website. It's called My Healthy Community, and we heard loudly that the
Yeah, so apparently we're having some technical difficulty with the internet connection for Dr. Walker's presentation. So if it's possible, we can jump over this. There we go. She's back. We can hear you.
I don't know. The technology is fine all the way until now. But what's important is that we are launching data on My Healthy Community specifically by race. This is how we can provide more of that in-depth data by zip code, and potentially in the future will extend even further. If you're not familiar with this website, we do want you to know that this is a build on to the My Healthy Community data portal that we launched in May 2019. It delivers neighborhood-focused population health, environmental, social determinants of health information to the public and conveys the community's ways to explore a variety of data indicators. We think it's important that communities have information about their neighborhood in their hands. This new coronavirus data that you're seeing in the community supplements the existing dashboard that's on our coronavirus website. It doesn't replace it, but it just gives additional information and drill down. So I encourage everyone who's interested to take time, explore the data, and I want to call your attention to a few data sets. The first is that, as the governor mentioned, we are seeing an increasing rate of positive cases in Sussex County. That's more than twice the rate of infections in Newcastle County. That is based on the number of positive cases and the population of Sussex. As the governor, Dr. Rattay, and I have said for weeks, we all certainly must behave as if we have coronavirus. But nowhere is this true more than in Sussex County. So we have a lot more work to do. But I want to make sure that everyone knows we want to help our neighbors across the state. Right now, our attention has to be to support those in Sussex County. For older Delawareans in Sussex and those with other chronic health conditions, we absolutely need you to stay home 24/7. If it's not essential, please just reconsider. Do not go out for groceries or prescriptions. We can certainly help you get needed food, groceries, prescriptions delivered to you. Just call us at 211 for assistance and we will make sure that you have what you need. If you live elsewhere in Delaware or have a vacation home or relatives who live in Sussex County, we ask you right now to not go visit your relatives or that vacation home. If you go, you are likely to expose yourself and your loved ones to coronavirus. But most importantly, if you're sick with an elevated temperature, a cough, shortness of breath, sore throat, or body aches, we need you to stay home. Please, please stay home and self-quarantine. Monitor your temperature, and call your provider, your primary care doctor, who can guide you on whether or not you need to be tested for COVID-19. If you don't have a provider, the Division of Public Health will help you. Call Delaware 211, and we will make sure that you have information and can get an order to be tested. Finally, I want to offer a few words to our neighbors whose first language is in Spanish. And for those of you who understand, I'm doing my best and trying. But no tenga miedo si su doctor le ordena a usted a tomar pruebas médicas. No tenga miedo si su resultado es positivo. Y más que todo, no tenga miedo si usted o un miembro de su familia necesita atención médica. Si sus síntomas se ponen más severos. Nosotros estamos aquí, el gobierno estatal y la comunidad médica, para ayudarle a usted y a su familia. Y recordarle que su privacidad está protegida por la ley. La salud de su familia es nuestra mayor prioridad. Por favor, llama a todos. Translation, do not be afraid to call a doctor if you have symptoms of COVID-19. Do not be afraid if a doctor refers you for testing, and do not be afraid if your test is positive. And most of all, do not be afraid if you or someone in your family needs medical care because your symptoms become severe. We are all here, the state government and the medical community, to help you. We want you and your family to feel safe, and we will respect your privacy. Your family's health is our highest priority. So to support our neighbors in Sussex County, the Division of Public Health this week, in collaboration with hospital systems, community organizations, and large employers, expanded free rapid testing across the county. This will also include expanded outreach and educational efforts, making sure that individuals and families who cannot leave their homes, cannot work, and cannot go out to get essential items and groceries and prescriptions, that they will have the support they need from social services and community organizations to support those needs. Again, if you do need medical or social services support, or anywhere in our state, but including in Sussex, please call Delaware 211. And finally, I wanted to touch on testing. First, the Division of Public Health, which runs tests on specimens collected primarily from healthcare providers, first responders, and residents and staff from long-term care facilities, has run a total of 2,708 as of April 23rd. Of those tests, 669 have been positive and 2,114 have been negative. And the healthcare systems in our state, which make up Delaware testing program, have collected a total of 19,595 specimens as of April 22nd. This information is now posted on our community portal as well as on our dashboard. Thank you, Governor, for that opportunity to give an overview.
Thank you, Dr. Walker, and thank you for displaying your Spanish here on the presser today. I'm glad that your Spanish teacher had a better result with you than my Spanish teacher did with me for 4 years. On the testing, I want to take a minute before I hand it over to AJ. Just comment and thank our partners in testing, because most of the testing that's done, most of that 20,000 tests has been done by our hospital partners, from Christiana Care to St. Francis and to Nemours and to Bay Health and to BB and to Nanticoke and to the VA, and so we appreciate all of their work. We are starting to do additional testing in the Sussex County, Georgetown area, and did some of that this week. As I indicated earlier in the week, we are going to do. We also have moved, Christiana Care has moved their Middletown mobile unit up to PS DuPont for a mobile site there, and are looking at other areas around Newcastle County, particularly areas that with underrepresented populations there, and we appreciate their outreach with that, and we will continue to use data to drive that. We're also looking at doing some testing in the Route 9 corridor as well, and there'll be more about that later. So thank you to our testing partners. As I mentioned at the beginning, one of the biggest challenges, if not the biggest challenge that we have, is to develop a testing program that's kind of 2 times or more, 3 times as robust as this, and this is close to 20,000 tests. So you can imagine the number of tests that we'll be doing, the staff that will require, the coordination necessary, and obviously the partners who have been with us all along the way. So, Dr. Walker, thank you. Thanks for coming in, and turn it over to AJ Shaw.
Thank you, Governor. It was January 22nd when we had our first state call that had started discussions about preparing for COVID. And I think we've come a long way in that time, but we still know we have a lot of work to do and a lot of outreach to do with our communities. To talk about a little bit about the personal protective equipment that has been distributed in the state, Public Health Warehouse has fulfilled over 900 orders, which includes 800,000 pieces of equipment and over 650 gallons of hand sanitizer, and that's gone to hospitals, first responders, nursing home, and medical facilities. They continue to accept orders and push them out as quickly as possible. As I said last week, we have had a little bit more success in the supply chain, so we feel that the personal protective equipment has stabilized a little bit. However, we are still trying to procure when possible and make sure we know that this is going to be around more than just the next few weeks. Delaware National Guard. I've said for years now that they are our muscle and our our voice and vision on the street, and that's definitely showing through right now. They have taken on multiple medical missions with Nemours, with some state facilities. They are working to prepare for surge capacities at a number of facilities around the state to really kind of be that plug and play type mentality that and program that we need to be flexible to handle the uptick in COVID positives. They've also been busy this week in building these care kits that I know Dr. Walker and Dr. Tate talked about last week. We know that we have communities down in Sussex County right now that are having a higher incidence and positive percentage of cases. We need to make sure we provide them supplies and what they need to help slow the spread, and that is everything from cloth bandanas to make face coverings to thermometers to hand sanitizer to just a simple bleach and water solution and paper towels to make sure they could sanitize the areas where they live. We know there are individuals that are living with multiple different people, and sometimes having that capacity in an apartment or a home is going to potentially increase the spread. We want to make sure they could slow it down as much as possible by hygiene and cleaning. So GUARD has been instrumental. We will have about 10,000 of these to distribute over the next week, and still ordering more supplies. Today, I believe right now, they should be finishing the third of 3 food missions as well with the Delaware Food Bank. They did one on Monday in Newcastle. They did one at Dover Downs, which we have a picture of here, on Wednesday, and then one at in Sussex County today. Each time they've provided food, and this is everything from vegetables to canned food to milk to juices to about 2,000 families. I believe it's about 2,200 on Monday, just under 2,000 on Wednesday, and I haven't got the numbers today, but looking at millions of pounds of food to help the communities impacted by COVID really sustain and just help a little bit to make sure people aren't going hungry. So not just kudos to the National Guard here, but the volunteers that are out there today, as well as the Delaware Food Bank, who's making this all happen. Talked about the personal protective equipment, but what happens is we get these in boxes of, tens and 20,000s, and then we have to put out push packages to go to either hospitals or public safety agencies, and the National Guard are the ones right now peeling those apart and creating the other packages. So a tedious task, but it is letting public health be more reactive and put their expertise in other areas that need to be handled. One thing that I think Dr. Walker quickly covered was 211, and they are what I would call the community's lifeline right now. They're going to be able to help meet unmet needs to the best of our ability to those that are impacted right now. Every day we get a summary. They're taking a few hundred calls a day. It's a very dedicated team, and they're helping us get them to the right individual to answer their questions. Just 2 quick stories I'll share with you. First was, and it's great. So when they send us these summaries, they send us 1 or 2 abstracts from, good and bad data that they're getting from talking to these citizens. And just 2 stories today that I think show the importance of the partnership with 211 and how resilient the Delaware community is. So there's a father and son that called. Father was 72, son was 37, and son was furloughed from work and trying to do something with his father, but not able what they could do because of the stay-at-home orders. And calling 211 just to see how they could volunteer, they were linked up with one of the pantries in their neighborhood and were able to go out and assist them over the next several days. So again, not something that they needed from 211 or DHSS, but a way they were able to help their community. And then the second one, a woman called 211 from Ohio, calling for her father, who was 75 years old and just knew he wasn't able to get to the grocery stores because of the stay-at-home order. And 211 was able to reach out to the West End neighborhood house to get individuals to actually go to the grocery store for and pick it up and deliver it. So these are, 2 of approximately 15 to 20 stories we receive a week from the United Way, and it just shows you how how special the community is in Delaware and how much United Way is helping us navigate through these tough times. Lastly is our hospitalizations. Governor's talked about this since March 11th in our first press conference. It is the area that probably we spend some of the most time discussing and making sure we keep our fingers on the pulse. And this is not as good a story as the United Way story, but you'll see here the hospitalizations for Newcastle County, Kent, Sussex, and then overall in the state for really 3 different time periods, with the most updated being yesterday, and that number is going up, and that is not good. We are in constant communication with our hospital systems across the state. They are in a position right now where they still have several hundred beds available, but we need to make sure that if people need medical assistance, they're contacting their primary care physician, or they're going to the hospital earlier rather than later. Dr. Walker hit home on that as well in her overview. Last week, 2 of the hospitals in Sussex County had individuals that were walking into the hospital, and within hours were already in the intensive care unit, and that is what is going to really impact the hospital system, and it's not good for their health. So if somebody is sick, if you think somebody needs medical care, have them contact their medical provider. If not, then they could go to the hospital or call 911. And as we work with our healthcare communities in Sussex County, we're going to make sure we do the best to get healthcare professionals in the community to do outreach with the individual. So the hospitals are getting busier, which we don't like to see, but they're able to handle what they have right now. And we want to do everything we can to make sure we get the care to the person before it's too late for them. So with that, I'm going to turn it back over to you, Governor.
Yeah, so thank you, AJ. Thank you for your leadership and that of your team. And just to underscore a couple points as we close it out, and that is that we have a serious situation in Sussex County. And as Dr. Walker and AJ have mentioned, there are certain guidelines that everybody needs to follow. And they are things that we've been saying for the last 6 weeks here, or not quite 6 weeks with our stay-at-home order, but to stay at home, to practice basic hygiene, to protect your neighbors, and in the process, save lives, and also in the process to prevent the spread of the virus from going further into our communities. And we will and are leaning into this effort in Sussex County to treat those who are sick, to help them with resources that they need, to help protect those who are without the virus, and all of the rest. So again, thank you for joining us today. We're on this together, and we're going to get through it together as long as we follow the instructions and follow the guidance that we've been talking about now for over 6 weeks. So with that, I'll open it up to questions from the press. Meredith, thanks for coming.
I have a lot of them, so get ready. So to start off with the race data, it's showing that Black Delawareans are being affected the most. What is the state doing to make sure that Black Delawareans, specifically in the Newcastle County area, aren't continually being disproportionately affected by the coronavirus?
Yeah, so the main thing obviously is treatment in the hospitals when they require hospitalization. The second, I think, most important thing, and we continue to move to that, is kind of over-testing or targeting geographic areas with larger proportions of people of color. We mentioned the testing, the Christiana Care moved from Middletown to North Wilmington, the testing that they're doing in conjunction with the LACC, testing that was done out of Henrietta Johnson, and our plans to do testing along the Route 9 corridor. Right now, there's intense focus on testing and outreach to the Hispanic, to the Haitian Creole population, and Caucasian poultry worker population in Sussex County. And that's taken a lot of our resources and a lot of our time, and we really have a lot of work to do there, and are adjusting our plans based on what we're seeing on the ground in terms of test results.
And in terms of, I think the data said 40% was unknown in terms of race. How much of that does the state see as retrievable eventually, or were those issues with going back and not being able to get the race data? Is that what makes up that 40%?
My understanding was the 40% was the first increment before we went and matched up the two databases, and that in doing that matchup, so we matched up the public health, what's called DEERS database, with the DIN, Delaware Health Information Network database, which had more racial and ethnic data there. And we picked up another, 20%. We have about 20 or 25% without data, somewhere thereabouts, is my understanding. And so whether we'll be able to fill that in, we're certainly going to act on the data that we have and some of the things that we know. And I don't have hospitalization data that I know by race. That's something that's important to have. We do know the breakout of those who've passed away, and the people of color who've passed, or African Americans who've passed away, is about just a little bit above the percentage in the population at like 24-25%. So of our 92 deaths. And then the infection rate, which we talked about, which is much higher, and that is concerning. One of the things that we are seeing in the data is that the participation rate, the number of tests done for African Americans, is at a higher rate than their percentage in the population, which gives you a little bit of a confidence that maybe it's not a testing access problem. That doesn't mean we're not going to try to reach out into those areas, but it would really concern me if the rate was less than the distribution in the population at 23%. Dr. Walker, I think, wanted to add something there.
Well, if you wish, Governor, I'm happy to share my screen and show you the data as we have it. because I think it is important to know that our race ethnicity data is improving. As you mentioned, we enriched the data. We were able to get some gap close in the number of unknowns, but that should grow smaller as we have more documented race ethnicity and work backwards to make sure we're filling in that data as well. Happy to do that demo if that would be useful.
So are we able to tee up the demo, or should we go to another question?
She just has to share her screen.
You need to share your screen, Dr. Walker, I'm told.
Great, that means go. I will do it.
Well, that's teeing up. Meredith, did you have another question?
Oh, yes, I did. Going to education, how is the state going to make sure that the students who are already slipping through the cracks are not going to continue?
Yeah, it's a real concern and a real issue. I compliment the districts for doing creative things to connect their students. I compliment Comcast and other providers for making free access to internet access. It doesn't mean it actually got connected in homes, and that's a challenge. I know Brandywine School District in particular, for example, distributed notebooks or laptops to help with that, but without connectivity again. And the other thing that I heard from teachers and students alike was just the engagement question, right? To get students to engage as opposed not to engage when it's remote learning like that. We talked a little bit about that before. So yeah, it continues to be a challenge. I think it will continue to get better. I know the districts are conscious of it, and obviously they also have legal obligations there, which that motivates them as well, and us.
Do we want to do the...
So how are we doing? It looks like we're go with the Dr. Walker.
Great. So as you can see here, there's a myhealthycommunity.dhs.delaware.gov homepage that lands you. Once you click on coronavirus tracker, you can start to see the same information on the dashboard that's displayed on the main homepage. But now, not only will you see the shading that you can see on the right-hand side of the screen with the rate of COVID cases per population, which again is a better marker than the number of cases because it's adjusted by the underlying number of people in that particular area. I think it displays where we may have areas of concern, and you hover over them, you can see the number of positives per 10,000 people. So as I mentioned earlier, we are worried about Sussex. You can see the number of negatives as well. But as the question emerged, along with the number of cases, the age breakdown, here you can see the total cases by sex, female and male. And then you'll, below that, get to the total cases by race, ethnicity. So we've highlighted the number of unknown in the lower row, but you can also see the number of non-Hispanic Blacks, non-Hispanic whites, Hispanic Latinos, other populations in the Asian Pacific Islander, along with the bar graph. And you'll see that although we still have a number of cases unknown, which we expect to drop because the public health order, Dr. Rattay, has required that physicians complete race ethnicity data, so it will improve over time. I think what's really important is, as the governor mentioned, you can see that 27% of our cases are white and 26% are Black. About 23% of Delaware's population is Black. So right now you don't see a huge difference in discrepancy in racial and ethnic disparity and difference between the underlying diversity in the population and the number of cases. But when you look at things more closely, like testing rates by race, we start to look at other factors, as you mentioned in your question. And also you'll see that 14% are listed as Latino. You can also start to see a breakdown by the number of people in particular outcome areas. So you'll see here the total deaths by race and ethnicity broken down. And you can see 62% of individuals who have died from COVID-19 are white.
Did we lose you, Dr. Walker?
You know, right now we have 7%, about 6 people who are unknown. We're trying to improve that information, but I do want to make sure we highlight that. Hopefully I'm back. I can see everybody.
Can you go back to
and then
Dr. Walker? Can you
Sure.
can go back to that chart. We heard the very first part, the reference to the white percentage, but then you blacked out.
Thank you. So the total deaths by race, ethnicity are shown here. And again, it's the bar graph broken down by race, ethnicity categories. So we have the race data for those who have died. About 62% of individuals who have died from COVID-19 are white, 23% are Black, and 4% are Hispanic Latino. Right now, we have about 7%, roughly 6 are unknown. And sometimes that could be multiple categories or not designated. We're constantly trying to make sure we improve this data, make more available. We anticipate adding more demographic data as we go, and as numbers become larger, we may have additional dashboards and features available. So please definitely go to this website. Feel free to let us know if there are certain things that you want to know. As you can see here, we've also included negative numbers so that people can have access to this data. Thank you, Governor.
Thank you very much, Dr. Walker. And one of the things to keep going back to, and that with respect to the demographics, is that overwhelmingly these are elderly Delawareans, sadly. There are grandmothers and grandfathers, and they're folks that with underlying health conditions, which underscores again the need for us to protect those populations, to be talking to and supporting our elderly parents, our neighbors, and the like. And one of the things that informs us as we look at this spread in Sussex County, knowing that the population there has a lot of retirees and a lot of elderly citizens.
And I wanted to ask about the chicken processing plants. With the state starting testing this week, or working with the plants to do testing, how many have tested positive from those test results?
So I don't have the exact number, but it's very high.
Is that something the state would make public?
I don't think at this time we're able to do that, but at some point we would like to do that.
I guess what's the difference between having data about nursing homes and the number of cases and deaths? I think something people really want to know about, especially if you're working in these plants and live in these communities.
So I think it's twofold. One, it's small numbers at this point in terms of the number of cases that we've actually, number of tests that we've actually done. And it's the partnership that we've had with the plants in doing that. So we can sort that out as we go and do more testing. What we do know is that there were a lot more testing that was done by Christiana Care, again with a very high percentage of positive cases.
So if there was a large outbreak at one of the plants, the state would go public about it?
Well, I think we are going public about the problem right now, talking about the issue that we have in this community and our efforts to address it.
And there's certain governors that are, like in Iowa, for example, that are shutting down or urging plants to shut down due to concerns over continued outbreaks. Is that something that you would consider doing, and what steps would have to happen?
Yeah, so I'm not aware of plants that governors have shut down. I know plants have shut themselves down for various reasons, and it's certainly one of the options that we have if we think it's the best thing for the safety of the workers and the population around the plants.
A number of questions about Sussex County. Mary Lou at WGMD says that she knows the focus on Sussex County is on the minority workers in the poultry plants to get them tested and educated on how to stay safe. But there are other work areas that are minority heavy, such as construction and landscaping companies. Are these types of businesses also getting the same type of scrutiny and attention as the poultry plants?
So generally, we've had some community testing sites which were open to everyone in Sussex County, and we expect to do more of that. We have a list of those types of businesses that have workers that might be living in the same communities. And so, yes, we're looking at actions that we should take or should consider with respect to that workforce as well.
Matt Biddle at the Delaware State News asks, why do you think Sussex has been hit disproportionately hard with some of the recent statistics you're seeing?
Well, it'd probably be kind of not in my area to speculate, but I've said at briefings that we had here as long as several weeks ago when we first started to pay attention to this and send representatives of the Division of Public Health out to the plants after the first positive case at the Milford plant was identified. And you'll remember that the plant closed down to go through and do a full cleaning and sanitation. And then when we had a couple days later another positive case in one of the other company's plants in Selbyville, that we knew we had the potential for significant spread, knowing the communities in which a lot of these workers live very close together, very dense housing in certain areas of the towns. And so we started reaching out to community organizations and to others to try to get the word out and address what we knew was going to be a spread, or we expected would be a spread in this community, and we've seen that happen.
Matt Biddle again of the Delaware State News asks, what's the rationale behind not allowing more businesses, such as furniture stores and barbershops, to begin to open up by appointments only?
Yeah, so that's not kind of the area that I've spent a lot of time on. The Secretary of State and his team at the Division of Public Health have been responding to companies and businesses and sectors that want to be exceptions to our essential business shutdown. And so they have kind of by application approved some businesses to move forward. Let me give you an example, particularly in the list that you gave, and that is, say, realtors and car dealers can do business by appointment only. You mentioned furniture stores. That's a business that theoretically could be doing business by appointment only, and I know it was something that the Division of Small Business and the Department of State was thinking about. So that's kind of the way it will evolve. You know, let's be clear about the situation, though. The guidance we have is the cases have to be declining consistently in Delaware before we start opening businesses sectors up. And that's what we're looking for. Now, at the same time, we have this spike in new cases in Sussex County, which is going to prevent that possibly from happening, or at least from getting to the starting line. And so we're going to continue to look at ways to do that, to open businesses up as we get healthier in the community, but we need to be healthy in the community first.
DJ McEnany from WDEL asks, does the state plan to jump on Newcastle County's innovative partnership to study coronavirus spread statewide through wastewater analysis?
So the first I knew of the wastewater analysis piece is what I read in the paper. It wasn't anything done in conjunction with our Division of Public Health, and so I defer that question. We're trying to follow the science that public health officials are working on today, taking our lead from CDC and the White House task force. And this is not any science that I've heard of from my colleagues across the country, and that was the first I saw of it.
Tom Lehman at WBOC asks, can you describe in detail the steps to get to phase 1 and then phase 2? How many days will the state need to reopen once it gets the ball rolling on phase 1? And will the clock go to phase 1, restart with a single day that was higher the day before? Can you kind of go into some detail about that?
Yeah, so I think we have this slide in the deck that goes through the various conditions that need to be present on the ground for economic recovery. First of all, we're going to, when possible, follow the guidance from CDC. We need to adapt some of those measures and criteria to the Delaware situation. I talked a little bit about that in terms of consistent trend in declining cases. Since our cases tend to spike up and down from day to day, some kind of smoothing measure that would maybe 1% of positive cases by day is what statisticians have recommended. The next thing is that, again, 14 days, you have to have those positive cases or some measure going down. The next slide, and I mentioned this earlier on, this has to be in place, the ability to hire and train several hundred contact tracers, and more importantly, or certainly as importantly, the ability to have the testing capacity to test enough people statewide in areas of concern, so that you can deploy this cadre of public health workers to make the contacts with folks that the positive people have come in contact with and who might be sick and positive as well. We also need to, again, have the reliable source of test, the next. And also that, and this is something that I talked about, working with various sectors to figure out how businesses can open to follow more rigid social distancing requirements and guidelines, and we'll be working with each sector on that. It also might mean opening in certain sectors with the requirement that people wear masks, both the employees and folks that are going to that particular business, and we're, as I said, working out on these details. I think that's it in that stack. So that answers that question. So declining trends in number of cases or percentage of positives, the ability to test and do contact tracing on the ground, the ability to protect frontline healthcare workers and first responders, and hospital capacity in place should we need to address a surge.
The next question is from the Delaware Public Media, perhaps best for Dr. Walker. In light of the new racial and ethnicity-based data that we're seeing, is there any intent to discuss going down maybe even lower below zip code level to census level block data?
Dr. Walker, did you hear the question?
Yes, thank you. So what we really appreciate about the My Healthy Community webpage is that it overlays not only geography, but also make sure that we're putting some filters in to make sure that we're not reporting data that allows people to be easily identified, and thereby releasing individual level information that really would allow someone to be identified from these maps. So the challenge with census tract is that as you get smaller and smaller by neighborhood or block, it's very easy to figure out who that one person is based on their age and gender and where they're living. So this tool will allow us to report that information by census tract once we have enough cases and numbers easily identified. And usually that means by census tract you may have 10 or more people so that you can't identify them. But we have those filters in place to both provide information in a transparent way, but also to ensure we're protecting individual privacy. And so continue to check back on the website. Again, as unfortunately as numbers grow, it will be easier to report that information at lower and lower levels.
Thank you, Dr. Walker.
Thanks, Dr. Walker.
The next question is from Joseph DiStefano at the Philadelphia Inquirer. He says, according to FEMA data, Delaware has received far more PPE, N95 ventilators, and other coronavirus equipment given its population than next door neighbor Pennsylvania. The question is there any reason Delaware has been more successful in getting requests filled from FEMA? And does anybody deserve credit for bringing more federal aid to Delaware?
I'd give credit to A.J. Shaw, I think.
So I haven't looked at the specifics next to Pennsylvania. I will tell you we worked with our federal partners very closely and provided burn rates for what we think we would use for about a 14-day period, and then request that as needed. So without looking at the data, I would be unable to say why we might be getting more than them. But I think everybody in the region works together. We have calls with Virginia, Pennsylvania, Maryland, DC, and West Virginia several times a week with our FEMA regional administrator and talk about a number of these issues. So I don't think anybody gets credit more than the other. We're all in this together just like we are in the state.
The final question for today comes from Susan Canfora at Coastal Point Newspaper. She says, is there any direction from the governor's office for beach businesses wondering whether or not to order souvenirs, supplies, and even start interviewing employees for summer help? Some really aren't sure what to do. Any kind of forecasting on if businesses will reopen at the beach, Governor?
Yeah, that's a really tough question, and one that I've gotten on our the conference calls that we have with the state's mayors and the conference calls that we had this week on the Restaurant Association. Since many of those are there, I'm just going to ask if we could put up on the screen again the 14-day slide, just to give folks a certain idea. So again, as I said, what do the conditions have to be in order to start reopening beaches, for instance? And there's a specific reference in the White House guidelines, the CD guidelines, with respect to beaches, with respect to bars, and with respect to other businesses. But first of all, you have to have declining cases. We're probably going to define that by percent of positive cases, so moving downward, fewer day by day, for a 14-day period. And all those other conditions that I mentioned in place, a contact tracing ability and core of public health employees, a testing regime and capacity to do double the amount of testing that we're doing now, the ability to provide protection for our healthcare workers and first responders with PPE, and a comfort level with respect to hospital capacity, and in particular critical care and ICU capacity, which is something that we look at and are concerned about. So if you have those all ready to go in 14 days, then you can move to phase one. And I'm sorry, if you have the declining cases 14 days, you can move to phase one. If you have all those other things in line, you need another 14 days of declining cases to start to really start opening things up, which includes beaches. So if you do the math together, that's 28 days. If we were to start tomorrow, which we're not ready to start tomorrow, that would put you at the end of May. And so we're at least a couple weeks or more in front of the starting line. Add 28 days to that, and that gives you an idea of when we might be thinking about opening beaches, to be specific to the question. And I think that was the last one. One of the harder ones of the afternoon, and one of the more difficult ones as we move forward in the next month. And as I said at a press conference earlier in the week, the decisions that we have to make today to address the situation in Sussex County, and the decisions that we have to make over the next month as to when and how to reopen our economy in a phased, gradual, safe, and sound way, are going to be the most difficult decisions that we've had to make during this pandemic. And we need to do it with your help. We need to do it with your understanding. We need to do it with your cooperation, because we're not going to get to the starting line for the countdown until we have a declining number of cases. And right now, we have an increasing number of cases by day, although today's number doesn't show that. We'll see that probably tomorrow. And we have an outbreak that we need to get control of to make sure that it doesn't spread anymore. And we are all hands on deck addressing that issue. So again, I want to remind everybody to stay at home, to practice basic hygiene, wash your hands, cough into your sleeve, talk to your neighbors, protect your grandmothers and grandfathers, your moms and dads who are senior citizens, and together we'll be able to save lives. Thank you very much. Have a good weekend.